This video is about the modified Thomas test for the iliopsoas. The modified Thomas test for the iliopsoas is used to assess the length and flexibility of the iliopsoas. The iliopsoas helps move and stabilize the hip joint. The iliopsoas muscle is connected to the psoas major muscles. Hip flexion is what the iliopsoas is responsible for. Step by step. Start by having the participants sit on the edge of the flat surface, then have them lay in a supine position and have them flex their non-testing leg towards their chest midline to maintain stability, and the testing leg should hang freely off the testing table. Then place the inclinometer on the posterior side of the thigh for the degree angle. Quantification and Analysis. Summary of the results indicate that both legs fall in between the normative range, which is 80 to 90 degrees. The left leg was 88.5 degrees and the right leg was 80 degrees. This is considered functional based off of the qualitative cutoff. The cutoff for asymmetry is 10%. Soccer will be a relevant sport as the iliopsoas helps with hip flexion, which helps kick the soccer ball with force. Conclusion. The results above show that there is an asymmetry of 9.6% between the left and right leg. Although it is within the range of asymmetry, it could be a lack of symmetrical hip flexibility and strength. The next assessment we will be talking about is the modified Thomas test for the rectus femoris. This test helps assess the length and flexibility of the rectus femoris. The rectus femoris is one of the 4 quadricep muscles and is considered a biarticular muscle as it crosses the hip and knee joint. The rectus femoris helps extend the knee and flex the hip. Hip extension is shown within the testing leg. Knee flexion is shown throughout the whole test with the testing and non-testing leg. Step by step. Start with the participant on the edge of the table, with both legs hanging down. Next, have the participant flex both knees towards their chest line. Then have the participant extend the testing leg off the surface. Then place the inclinometer on the ASIS for a proper degree angle. Common errors to avoid would be having inversion of the knee and your lower back not being flat on the surface. Quantification and Analysis. Summary of the results show that both legs fall between the normative range, which is 70 to 90 degrees. The left leg was 86.2 degrees and the right leg was 82.2 degrees. This shows that this is the optimal range for qualitative cutoffs. Placing the inclinometer on the lateral thigh helped with consistency of measurement. This is proven to be optimal range of motion as normal flexibility is shown. The asymmetry cutoff is 10%. The sport soccer is a great example as you need a balanced rectus femoris. Conclusion. The results above show that there is an asymmetry of 4.64% between the left and right leg. Although the asymmetry is within the range, this can still show an imbalance and discomfort.